I apologize for the technical difficulties. I just went over this a few minutes ago and it worked perfectly fine.
Try that share screen at the bottom, just hover over the Zoom control, and then select the presentation. Perfect.
Okay, we're good to go. I apologize for that. Thanks for your patience with me. So topics that we're going to cover today are Governor Beshear's executive order that was passed April 9th, allowing work comp to offer wage replacement if a first responder is taken off of work as a result of their increased exposure at work. So we'll go over that. We're going to talk a little bit about quarantine and continued pay versus paying temporary total disability benefits. We're going to go over the investigation process. As most of you know, workers' compensation historically covers physical injuries, which are much easier to investigate and confirm. Typically, flus and viruses and illnesses are excluded under Kentucky work comp. So that makes it a little tricky as our adjusters aren't used to doing the extensive investigation and research that it takes to confirm if someone does contract COVID-19, if it actually was the result of their employment or if they could have contracted it at a gym or the grocery store or, from some other means, which will take us into confirming where the true exposure is. We'll talk about that. And when we get towards the end, Andrea is going to jump in and go over a few things as far as personnel and the temperature checking and just precautions that are in place. And then at the end, we'll have a Q&A session. I do encourage you to either submit your questions through the comment section of Zoom, or you can raise your hand and then we will allow you the floor to speak, and we can do that. If we happen to run out of time, we can still take questions and then put the answers together and email them out to everyone later, along with a copy of the slides and any other information that might be needed. So to reiterate on Governor Beshear's executive order, if you can see my slide, you'll see that the employee needs to be removed from work by a physician. KLC does utilize company nurse as a triage to report our workers' compensation claims. So if there is enough information that the nurse triages the employee to quarantine, then we are treating that as a medical professional and taking that the same way as if they had gone to their doctor. In order for the exposure to be considered occupational, there must be a causal connection between the conditions of the work and the COVID-19. So an example of that would be, let's take a paramedic that responds to a call and for whatever reason they don't have the proper PPE on. That definitely creates their exposure, versus if you have an internal employee that's just doing dispatch and they're not actually around patients in the field. So what that means is typically under temporary total disability benefits, there's a 7-day waiting period. And then as of day 15, work comp will go back and pick up from day 1. Based on Governor Beshear's executive order, the 7-day waiting period has been suspended as it pertains to COVID-19 claims only. So we could pay them from day 1 if they're in quarantine for 14 days. If they're only in quarantine for 5 days while they're waiting for their test results, we could also pay TTD for that 5-day period. I wanted to share the definition of an injury per Kentucky regulations, KRS 342.0011. You'll see in there it specifically states traumatic event or series of traumatic events, which can include cumulative trauma. And it also goes on to say which is the proximate cause producing the change. I wanted to go over that definition just to reiterate that typically flus and viruses and illnesses are not covered. So again, it's going to be a little tricky as we navigate these claims that are reported and doing the investigation on them. His order presumed that the removal of the workers by a physician is due to occupational exposure. It extended to healthcare, first responders, corrections officers, military, activated National Guard. Obviously, this is particularly important to Kentucky League of Cities, considering that we insure a good number of first responders throughout our state. It is not unique to KLC or to self-insureds. It is for all insurance carriers in the Commonwealth, regardless of, like I said, being a pool or an actual insurer. And payment by the employer is pursuant to this order does not waive our right to contest liability for it. So if we have someone that is quarantined, they have the medical note, and we issue TTD, we still have the right to complete the investigation and deny the actual claim. One thing that I'm seeing a lot of for us is when we have employees that have to be taken off work, most of the cities are continuing full pay for that. I've had only one that we've paid TTD on, and that was just because the employee was taken off work prior to the governor passing the CARES income, stating that the employers could continue pay. So to talk about the investigation, again, I can't reiterate enough how tricky this is going to be. If someone reports a claim for COVID exposure, there are a lot of questions that we have to ask the employee about their whereabouts. We'll need to know if they did respond to a call for a sick patient, did the patient's test come back positive? Is the employee going to be tested? Where are they going to be tested? Who have they been around in the past 14 days? Do they have a second job that could have increased their exposure from the second employment? Again, it's very extensive. So if you do have someone that needs to report a claim to KLC, I would encourage you to let the employee know that so they know what's coming. And then of course, when the adjuster is assigned and calls the employee, they'll also tell them about it, because it will be a somewhat lengthy statement that we have to get. And compensability may be accepted once we confirm that there is a positive exposure. Anytime we do an investigation, we will stay in close contact with our claim contact at the city, keep you advised of what's going on and where we are, any information that you may need to know or that you may be able to provide to us. We'll kind of walk through it together. And I know there's a couple of you on here that I've already had several conversations with about particular situations and what ifs. And so I think we'll do a good job of working through that together. Just call if you have any other questions. One important thing that I've seen is I've had a couple of firefighters that have had to quarantine, but when the city calls me, the city tells me, well, his wife is a nurse and his wife has COVID-19. She's tested positive, and that's why the employee has to quarantine. If we have a situation like that, then that clearly is not going to be a work-related exposure. That's not a question necessarily that we would ask someone about their family, but if the employee volunteers that and we know that they have confirmed exposure through personal contacts and not through work, then that's something that we would not pick up for sure. And in that case, if they were ordered to quarantine by a doctor because of personal exposure, not because of employment, then that would be another situation where TTD would not be instated, just because, again, the order has to be from a doctor and it has to be due to the increased risk with their employment. Okay. Just to let everybody know, we have not received as many claims to date as I had expected. As of May 25th, we'd received 187. I think that number is lower because a lot of our members are just keeping an internal track of possible exposure or an internal record. So what they'll do, if they send two paramedics out on a run and the person's coughing and has all the symptoms, they'll just log it and follow up and see if the patient tested positive, and then they'll monitor the employee to see if they develop any symptoms. And if that happens, then at that point, a lot of them will report the claim. Some of our members prefer that we keep record of it, so they are reporting a lot, and most of them are record only. Again, we've only paid TTD on one claim so far, and not because of denying, just because the cities are continuing to pay often, and because of so many of them are record only. And 99% of the claims we received, the employees were fortunate enough to be in full PPE. So when they call and report the claim and they speak with the nurse, they're advised that the exposure is really low and to just self-monitor, take your temperature. If you develop any symptoms, contact your doctor. So I'm happy to hear that so many of our people do have PPE available to them. I received an update recently from the National Council on Compensation Insurance, and I wanted to share some interesting things that they reported. Kentucky's not the only one that legislation has gotten involved with as far as the income replacement benefits, but some other states are creating presumption for certain workers, which, as you see, California, Louisiana, Minnesota, New York, Ohio, and Pennsylvania. It's a small number, but just thought it'd be fun to share that so you know that Kentucky's not alone with the governor's extending orders. And their report, 1% of workers, if 1% of workers were awarded benefits for COVID-19, losses would increase by 8% nationally. If that 1% increased to 10% of workers getting benefits, work comp cost nationally would increase by 85%. That's a large number. So I think it points out how important it is that if we do get claims, to do a thorough investigation, to confirm that it really is work-related instead of just giving the benefit of the doubt. Because Kentucky has not passed presumption on the medical, only the wage replacement. Okay, Andrea, are you on here and able to go over some of the?
I am. There we go. All right, so there's a few things that I wanted to talk about today that relate to COVID-19 and in particular to workers' comp. And one of the things that Angie mentioned was that a lot of employers are continuing to pay their employees when they're off. And what I want to make sure that you know is that if you're going to do this, make sure that you pay it under the Emergency Paid Sick Leave Act. And this is the federal law, the Federal Leave Act, under the Families First Coronavirus Response Act. There are 2 leave laws within there, but I'm only going to focus on this one part, the Emergency Paid Sick Leave Act, and only specific to an employee being diagnosed with COVID or having been quarantined by a healthcare provider. So you want to make sure that you're doing that and you're documenting, you get documentation from their healthcare provider. If you go ahead and designate that leave, the Department of Labor has issued an executive order that allows allows the payment, the emergency paid sick leave, to go against what's paid or what's required to be paid under the TTD. So that can counteract what's required to be paid under the TTD. So that's kind of an important provision, I think. And that way you've already used that emergency paid sick leave, or the employee has already used it. So they're only entitled to one bank of 80 hours for this. So that's used. It wouldn't be used again if they get sick again or have to be off again for COVID-related reason. They would have to use their paid sick leave pursuant to your policy. So, and again, documentation is very important. Under the CARES Act, you can be reimbursed for emergency paid sick leave, as well as many other items. And you can go through DLG. They have a site, website, and most of you all, I would imagine, are aware of this. But if you have documentation, this is one thing you can recover under the CARES Act. So that's really important that you know that. Also remember that when you're talking about when you're talking to the employee, trying to determine maybe where they were exposed, don't make an assumption that it was a family member. If you find out from them, you ask them if a family member has been exposed to COVID-19, that is a medical diagnosis. And if you were to, or they were to say you use that information against them as an employee, that could be a violation of the GINA Act. So we want to make sure that we're not asking. Better to ask, the EEOC is saying better to ask, have you come in contact with someone who has been exposed or who has been diagnosed with COVID-19? So that's kind of the better way to handle that one. Also, a few cities have accepted emergency responders from the Emergency Paid Sick Leave Act. If that's something you've done, then of course they wouldn't be entitled to it, but very few that I've talked to have done that. So if you have questions about any of this, just feel free to contact me and I'm happy to walk you through it. So let's see. The other thing that I wanted to talk about is the CDC guidelines for critical infrastructure workers. So some employers, if they have an employee that's considered a critical infrastructure worker, and that is going to be someone like EMTs, fire, police, your water and sewer, they can be allowed, if they have been exposed to COVID but are asymptomatic, so they have no symptoms, they can continue to work under the CDC guidelines. And I'll go over what those specific guidelines are. So if you are in, for example, a city that has only one water and sewer operator, and that person has been exposed, but they're showing no symptoms whatsoever, you could allow them to continue to work. And if you're going to allow them to continue to work, you want to make sure, again, that this employee has no symptoms whatsoever. You want to measure that employee's temperature, assess their symptoms before they start work, and preferably before they enter your facility. You want to increase the cleaning and disinfecting of areas such as their offices, their vehicles, any common areas that they may come in contact with. They have to wear a face mask at all times. And if you have to, you can provide them even a cloth face covering. They have to social distance, so they have to stay at least 6 feet away from other coworkers. And if they start showing symptoms at any point, they have to immediately go home. So that's kind of what you can do if you have to have someone who doesn't have symptoms but has been exposed. You can keep them in your workforce if you follow those guidelines. And again, you might consider that if you're short-staffed. A big con, I think, of doing this would be that you could be setting yourself up for potential workers' comp liability if that person is carrying it or does become sick and then they infect your workplace. So definitely, I would use this very sparingly. I would only use it if absolutely necessary. Also, remember, because they're entitled to emergency paid sick leave under the federal law, if you refuse to allow them to stay home and take advantage of that, it could also be another liability on the city. So if the employee is not willing to stay in the workplace, if they want to self-quarantine pursuant to their healthcare provider's direction, they can do so. They cannot be forced to stay in the workplace. A few other quick items, testing and taking temperatures in the workplace. So this has been a common question that's come up. Can we do that? How do we do that? So you can do it. Employers can do both. They can provide testing for their employees. They can also take the temperature of their employees. Remember that any of that information that you receive is medical information, so it has to be kept confidential. So that information cannot be given out to anyone. If you are going to have employees within the workplace doing the temperature taking, and you want to provide them with training and make sure that they are clear that this is confidential information. You want to provide them with gloves and masks in order to do this. And you can also allow employees to self-report and take their own temperatures and let you know if it's over that 100.4 threshold. Also, you want to, again, make sure you take the temperature before they come into the facility so that they're not already exposing anyone. and document any positive tests or anyone that's sent home with a fever, and that's for your records, and again, to cover you under the emergency paid leave. Also keep in mind that not everyone that has COVID has a temperature, and not everyone with a temperature has COVID. So that's two things to keep in mind. This isn't a guarantee, and sometimes it can actually present a false sense of security to employees, thinking that this is being done, so I'm safe. And the same thing with testing. And just because I don't have it today doesn't mean I won't have it tomorrow. So be aware of those things. And I see that there's a question that's come up here on critical infrastructure. So this says, what is the time frame that critical infrastructure workers would have to wear a mask if continuing to work? Also, if one of these workers gets COVID, do you consider this occupational if you don't know where they were exposed? And then subsequent employees in the same group around this individual, would it be occupational? Okay, so the time frame is they should have to, from the time of their exposure, probably up to 14 days after that exposure. If they're not showing symptoms, likely if they're not showing symptoms within 5 to 10 days, they're probably in the clear. To be safe, you would want to go out 14 days. And another thing that I probably should mention is, for specific guidance, I would absolutely contact your local health department and have them say, this is the situation, how should we handle it? And they are absolutely equipped to help you in these situations as to knowing exactly how to do it. The next question is also, if one of these workers gets COVID, do you consider this occupational if you don't know where they were exposed? And again, that's another one of those questions like Angie was talking about. We've got to ask a lot of questions to find out where that actually came from. If they were exposed on the job, like she was saying with an EMT, they had an employee that, or not an employee, but a patient that they were seeing that had COVID, then of course, we might relate that, we'd probably relate them getting it if that person did test positive later on to getting it from an occupation. But it's not always necessarily going to be occupational. The same with the people who are around this person. We can't automatically assume that this is occupational, and that's where your workers' comp people come in, and they can help you make that determination. So you want to call your representative for your city and talk to them anytime you have questions or concerns about, should this be considered occupational or should we go through the process? So hopefully that will answer that, and if not, I'm sure Angie can provide some more guidance on that.
Yes, I'm happy at any time. So sorry, Andrea. I'm happy at any time if you have specific questions or a situation that has come up and you want to talk and walk through whether it could possibly be related. Just give me a phone call. I think most of you probably have my cell phone. If not, my desk phone is forwarded to my cell phone. So yeah, at any time, feel free.
All right. The last thing that I really want to talk about, I guess it's really not the last, but it's close to the last, is how do I handle an employee that tests positive in the workplace? I think this is a question that comes up, even if it hasn't occurred. You definitely want to be prepared. You want to know what to do. Number one, I think it's really important if somebody tells you, they call in, they tell you that they've tested positive, is that you need to be empathetic. You need to be understanding, because this is probably a very anxious time for them. They're not sure what to expect. So make sure that you are very empathetic with them. Also, you want to act quickly to minimize the potential for this spreading. So you're going to notify anyone who's been in close contact, and close contact is within 6 feet of that person within 2 days prior to them showing any symptoms. So if you have employees that work closely with that particular employee, we want to notify them that they have been in contact with someone who has tested positive. But again, this is medical confidential information, and we're not going to release the name of the employee. Likely they'll be able to figure out who it is, but that's not for us as the employer to release that information. If the employee is still at work, they need to be sent home, or if any of those employees that have been exposed to this employee are still at work, they should be sent home, again, unless they're critical infrastructure and we're going to follow those CDC guidelines. But I still would give an employee the option to stay home if that makes them feel more comfortable. Absolutely, it would fall under, again, that emergency paid sick leave. Also be prepared to get a lot of questions. If you tell someone that they've been exposed to someone who's tested positive, they're going to have a lot of questions. And for the most part, I would direct them to the CDC website. Make sure you have all of that information available that you can give to them. And I would also make sure to tell them they need to call their healthcare provider. We're not healthcare providers, so the information that they really need needs to come from their healthcare provider. Also, again, document and remember that emergency paid sick leave will come into play. And clean and disinfect wherever the employee has been, their workstation, their vehicle, any equipment that they come into contact with. Make sure you follow the CDC guidelines for disinfecting. So that, again, is on their website. They have tons of information, and if you haven't been there, it's definitely someplace you need to go and look. Also, outside of those few situations, a few things I wanted to say were that you want to make sure you have someone designated as your Healthy at Work officer. So it could be your human resources person, your city clerk, someone that a person can go to if they have questions or concerns about COVID in general. So make sure you have someone designated to be in that position, and have clear policies in place regarding COVID-19. And if you have teleworking, make sure you have a policy in place regarding teleworking, have policies in place regarding the Emergency Paid Sick Leave Act and the FMLA, emergency FMLA leave. Make sure those policies in place. Make sure your employees get copies of them and they acknowledge them and they get the opportunity to ask any questions about what those policies mean and what they can expect. And make sure your supervisors are trained. This is a really important area. They need to know what are the signs and symptoms of COVID, so that if they have an employee that starts exhibiting those signs, you know, at this point, what do I need to do? And of course, they would probably contact their Healthy at Work officer. They're not going to handle it themselves. But to know what the signs and symptoms are, and also how to handle someone that they think is sick or that has told them they think they're sick. How do they handle that? And above all else, make sure it's clear to your supervisors. Any medical information that's discussed is confidential. So that can't be discussed. That's extremely important. And again, your supervisor should know who to contact if they have questions on how to handle. And lastly, I wanted to mention to make sure you have your FFCRA, your Families First Coronavirus Response Act poster hanging in your location of work, anywhere where employees gather, where you have the rest of your posters. Make sure that's hanging. And I would also have the CDC posters regarding hand washing, disinfecting, etc. All of that throughout all of your buildings to make sure that employees know the importance of hand washing and sanitizing and the proper use of masks, face masks if they're required.
Andrea, we did get a question and someone is curious if you could repeat your caution of asking about family members, lest there be violation of GINA Act.
Okay, so if you were to ask an employee if they have any family members that have tested positive for COVID, that's medical information. And GINA is the, I know what it is. Just taking a blank real quick. It is the, anyway, it is a discrimination act is what it is. So, and it has to do with a person's medical information. So if I find out that an employee's spouse has cancer, so let's just take it outside of COVID, but I find out an employee's spouse has cancer and I'm like, oh great, this employee is gonna be out all the time. And I use that medical information and I don't hire someone, or I don't promote them, or I don't give them as good of, you know, raise as someone else or training abilities, that could be a violation. So you don't want to use medical information against an employee. So the same situation here. If an employee has a spouse that has COVID-19, you wouldn't want to use that against that employee. Okay, because that could be a violation of the GINA Act. And it really, in my thought, it could be a little bit of a stretch to say it's a violation, but that's what the EEOC came out and said probably just a few weeks ago. So based on what the EEOC is saying, that's where I would go with it. I wouldn't ask them. I would just ask, have you come in contact with anyone who has been exposed to COVID-19 or is tested positive, because it's not just family members. It could be your neighbor, it could be your grandparents, it could be anyone outside of your household even that you could have been exposed. It could be a friend, a family friend. So just be aware of that. So don't ask that, just say, have you come in contact? And let your workers' comp people dig through the details and get that information. That's what their job is. And I also see on here we have a question about if you have any forms regarding taking daily temperature of employees. And I do have that. So I can make sure and get that out. I'll make a note so I can get that out to you, and also have other information that we can send as well. Yes, thank you, Morgan. The Genetic Information Non-Discrimination Act. That's what GINA stands for. I knew I was just drawing an absolute blank on that one.
Okay, Chris, do you have anything you want to add, or Mark?
I think you all have done a wonderful job covering everything. I think you've answered most of the questions.
Yeah, I kind of feel like the nightmare you had when you walked into the law school class and it was a wrong class. So this is kind of outside of my normal area. I did do workers' comp defense for about 1.5 years or 2 years, and that order that the governor passed is, as far as the assumption, but then in the last sentence that doesn't mean it can't be contested later. From a defense lawyer standpoint, that's going to be really difficult to do, and it is heartening to hear that hasn't really been an issue so far as the claims we've had on that. One thing I would like to mention briefly on this is, kind of goes hand in hand about the keeping the safe options for meeting in groups. Is that we've recently expanded to having 10 people, and we've had, I've gotten a lot of calls just this week, and I saw there were a lot of clerks on here as far as meetings. And we have put guidance on the klc.org site as far as, some of the best approaches to take now that we can meet with 10 people, again, with social distancing and all that being part of that. And I just want to take a quick moment to mention that, it's great that we all want to get back together. And I know everybody's going stir crazy and wants to, everybody wants to get together and start meeting again. But I think it's important to keep in mind that even though that 10-person, option is there as far as the meetings, don't lose sight of the fact that, you have, and frankly, the numbers just bear this out, that the majority of our elected officials at the local level are in those at-risk age groups. And you may very well, because I've spoken to several of these folks, that, just because the ability to meet in person is now there, up to that 10 people, which, in a mayor council form of government, you get the mayor and the council, that's 7 right there in most cities. And then you have the city clerk like Tony, that's 8. And, you get the one person from the press. Now I realize that's 9 people is usually about as many people that ever show up at some of these meetings, but you need to be mindful of the fact that you may have at-risk people. And, and frankly, there have been some situations where a mayor knows that some of the older people or more seasoned people on the council or commission are no votes. And there's like, well, we're going to go ahead and meet in person. If you can't show up, tough. Don't lose track of the fact that, you still have these video conferencing options, not just for the council or the commission or the board of commissioners, but for your citizens as well. So, that's kind of going in line with, keeping your eye on the fact that, we do want to limit contacts and limit exposures as best we can with this. But the information that we can, that we can provide, and especially what Andrea and Angie and Mark have, is bar none. I mean, these are the folks that know exactly what's going on with this. And we always say, if you have questions, contact KLC, but that's the truth. And, one thing I'm a firm believer in is that, the most expensive calls we get at KLC are the ones that aren't made. So if you have questions about, are we doing something right, or, we're thinking about doing this, especially if you think you have the greatest, newest idea in the world, give us a call first, because we may have some experience in that. We likely do have some experience in that. And if you're getting ready to take a very long walk off a short pier from a legal standpoint, we'd very much like to be able to talk to you before you do that. So again, with all this, it's one thing to be sitting on here as the legal folks, but common sense, especially with COVID-19, is a lot of it. And we realize there's a lot of paperwork and there's a lot of guidance from the federal government and the state government and even local government and your health departments. And we are doing our dead level best to separate the wheat from the chaff on this. But always be checking out klc.org. We're trying to work through this as best we can, and we're going to have options for y'all with this. So that's really, other than saying great job, Angie, great job, Andrea. That's really all I have to add.
I think we had a couple other questions. One was in regard to cleaning, how to clean, the guidance. And what I did is I put in the chat bar, I put in a couple of links for the CDC, and one of them is on the critical infrastructure workers, and the other one is on how to actually clean and what's expected by the CDC. So those are there, and if you need them after this, don't hesitate to call or email me. I'm happy to get them to you. And then it looks like we also have a question about, do you have guidance on the new OSHA filing requirements for COVID-19? And yeah, I did read that last week, and I pulled up kind of what I have put together on this. And really, the only time that a COVID-19 case is going to be reportable to OSHA would be if the employee passes away or if they're hospitalized as an inpatient as a result of COVID-19. So then that's going to be the only time it's actually reportable. They did talk about how to determine, they gave out some guidance on how to determine when it may be occupational related. And I know Angie has this covered. So, again, let your insurance, your workers' comp adjusters handle this part of it for you. If you have questions, that's what they're there for. So make sure and contact them about this. And if anybody wants specifics, I put together a little short article on this that hasn't been put out, and I wasn't even sure I was going to put it out. But if that's something you want, let me know, and I'm happy to send it to you.
Do you see that, Andrea?
I do see it.
You got that?
Sure. What if a worker expresses concerns, resentment over being asked to clean the shared equipment, common area, not break front desk or conference tables? I think, first of all, we need to be empathetic again, because why are they concerned? Are they somebody that's at a high risk? Are they over the age of 60? Do they have some underlying condition that if they were to get COVID, it would be detrimental to them? So, first find out why they have these concerns. The same thing for wearing a mask. If an employee doesn't want to wear a mask, ask them why, because it may be a medical reason and you may have to accommodate them under the ADA. So let's find out why they're concerned about it. If they're just being, for lack of a better term, I guess, ornery, that's a requirement that your employees do, then that's a managerial responsibility to make sure that they follow your policies. But again, I would make sure I knew why they were concerned about cleaning and disinfecting. But definitely people should be cleaning up after themselves. It's something that we do at KLC. You come through, you wipe everything down, just out of respect for the next person.
We saw your sanitizer, Chris. Good job. Any more questions? Anything else you guys would like to add, Andrea, Mark, Chris? Okay. Well, I appreciate everybody taking the time to sit in on this. Again, we are here for you to help you. So if you think of anything after, feel free to call or email any one of us. If you send it to the wrong person, if you send something to me that I can't answer, I will make sure to get it to the right person. And again, just thank you for your time. We're glad that everyone's doing well, and we look forward to seeing you guys soon. Thank you.